everybody, Dr. Chris here, orthopedic surgeon and sports medicine physician. And today, I'm going to talk about the real reason why your wait in the doctor's office is so freaking long.
What you say?
So apparently, there's some people in the world that think that us doctors just lounge around all day. But seriously, I read this article the other day in the Huffington Post. Apparently, I guess this lady had a bad experience where she sat for an incredibly long time in a doctor's office, and she basically concluded, number one, doctors and their staff just can't get their shit together. Number two, the doctors and in particular specialists are just arrogant SOBs. So I'm a doctor, step one complete, and I'm going to talk to you today about the reasons why sometimes you have to wait in the doctor's office, at least in my office. So there's a picture in this article, which basically is a sign that this doctor or a doctor in the United States had in their office on the door. To be quite honest, I could have that exact same picture or poster because I think the same thing. And the sign says, please be advised that your waiting time could be extensive. If you are unable to continue your wait, please let the receptionist know and she will reschedule your appointment. Thank you for your understanding and patience as the doctor takes the time to provide excellent medical care to every patient. So the first thing you have to understand is that when we say extensive doesn't just mean 5 minutes or 10 minutes. Extensive could mean 1 hour, 2 hours, and in some extreme cases I've had people wait 3 and sometimes 4 hours to see me in the clinic. That's what extensive means, at least to me anyway. And although there are differences between my practice and this practice, I'm in Canada, this specialist was in the United States, I'm an orthopedic surgeon, a different specialist. There are probably a lot more things that are similar about our clinics and the way that we run our clinics than there are differences. So a typical fracture clinic for me starts at 7:30. The clinic actually doesn't start until 8, but I'm there at 7:30, going over the charts to make sure that I can tell my assistant or the nurses who are with me which patients need x-rays before the clinic actually starts so that I can make sure that the clinic runs smoothly. The clinic typically will run till about 5, 5:30, 6, 6:30 p.m., however long it takes until all the patients are seen. And although I typically try to schedule only 35 patients, believe it or not, that's a small number of patients during that time. Typically those clinics have anywhere between 60, 70, sometimes 80 patients in them. Hi, Dr. Chris. What brings you to see me today? What did you do to yourself? And why did you do it? Hi, Dr. Chris. What brings you in today? Hi, Dr. Chris. What can I do for you? Hi, Dr. Chris. What can I help you with? Hi, Dr. Chris. What did you break? Hi, Dr. Chris. No, not TV repairman, sorry. Hello. It's Dr. Chris. What can I do for you? The clinic starts at 7:30 and it goes until 6:30. During that time frame, maybe if I'm lucky, I go to the bathroom 1 time. I eat 0 times. I do not take a break for a snack. I do not take a break for lunch. During that time, I am running back and forth from room to room for the entire time. Let's just take the clinic that I had on Monday, right? So at that clinic, I saw 70 patients. And if I was going to see them for 15 minutes like normally scheduled, well, because I was double booked, I'm seeing them for half that time. So let's just say 7 minutes times 7. So that's equal 490 minutes. There's 60 minutes per hour. That's 420. No, that's 8 hours and 10 minutes. 8 hours.
Why is it scheduled so that nobody can ask any questions? Do we have to go back to the beginning?
So let's do 35.
Yes, exactly.
35 patients.
Right.
15 minutes per patient.
Right.
Equals, what is that, 475? 475. So roughly, it's 15 minutes short of that, so that's 7 hours and 55. 7 hours, 55 minutes. That's a regular day.
Even 15 minutes
15
isn't very
minutes.
long.
No, 15 minutes for me to see you, see how you're doing, take your cast off, check the fracture or check the wound, take the staples out, take the stitches out, put on a new cast if required, talk to you about what the plan is.
That's not very
write
long.
out all the, yes, that's right.
Long.
That's not very long. But because of all the extras, we're down to that. So this is how many patients I'd like to see.
Yeah. Then they just make them come where they're
right.
You know,
so these are
they shouldn't
extras.
be allowed to come.
But I gotta see Dr. Chris. It's urgent. I need a prescription. I need a note for work. It just hurts. It's red. It's draining. Everybody wants to see me. It's urgent.
Okay.
So
I mean,
this
yeah.
becomes that,
Right,
which then means this,
right, which is nothing.
which is nothing. Oh, but you asked a question, right? And I got to give you an answer, assuming that it went over by 1 minute, just 1 minute. 1 minute per each patient. This has now gone to 550 minutes, which is another hour.
Plus 560.
560, right? So that's gone another hour.
And that's only a minute.
That's only a minute.
So like,
That doesn't usually happen.
Make it
'Cause
15 minutes.
Exactly. If somebody has to ask a question, it goes to 15 minutes. Just do that 3 or 4 times. That's an hour.
how long was your clinic on Monday?
My clinic was 11 hours. The moral of the story is don't get broken. Sometimes accidents happen though. We can't control it.
That's true.
So a fracture clinic is a clinic that I typically have once a week. This clinic does not even include consult patients. So if I schedule 35 patients and there are 70 patients in the clinic, where do those other patients come from? Many patients constantly phone my secretary stating that their problem is urgent. Even though they're not scheduled to see me until sometime in the future, something has come up and they need to see me now. To err on the side of caution, if somebody says that it's quite urgent, she will schedule those people in, even though they were not on the normal schedule.
Did you hear that?
Well, obviously, the people who have had surgery need to be seen in a set period of time. Some people might say, well, just operate less. Here in Ontario, the wait times are significantly long. If I performed less surgery, the wait times for you to have surgery would increase. So that basically means you either wait for a long period of time to see me in the clinic, or you're gonna come to the clinic and wait a long time in the clinic to see me.
What you say?
But regardless of the number of people that I see in the clinic, I have always made a promise to myself that I would always allow each patient to spend as much time as they require to understand what I was talking about and ask all of the questions that they needed to ask to feel comfortable when they left my office. There are other issues around the clinic itself which can also impact whether or not we are able to see you in a timely fashion. For example, during the clinic, my primary goal is to see the patients who are in the clinic. However, also during that time, I am often fielding calls from other physicians who may call the office, or emergency room physicians who may call to ask a question about a patient who they are seeing in emergency at that time, if I should be covering call at the same time. The number of nurses in the clinic. So just this past Monday at the fracture clinic that I completed, normally I'm scheduled to have 2 nurses. However, on that morning, one of the 2 nurses who was supposed to show up was unable to do so because of illness. And at times, I had to play both the role of surgeon and the role of nurse in order to expedite the flow in the clinic. In addition, as everything is now computerized, we are at the mercy of the electronic medical record and the computer system at the hospital. If there should be a problem with any one of those things, the pace of the clinic may slow down. Because of patient confidentiality rules, we need to log in and log out of the computer every time we come into or out of the room. Logging in for 30 seconds, you say, is not necessarily a big problem. But if I have to do that 80 times a day or 70 times a day, and it takes 30 seconds each time, right there, that is half an hour to an hour of additional time just spent on the computer. Just logging in, not looking up any of your information. If they're having trouble with the machines in the x-ray department, there again can be a problem which can add a substantial delay to the overall duration of the clinic. It's really not because I have a super huge ego or because my secretary or myself, we just can't get our scheduling shit together, but it has more to do with patient care. In order to see everybody in a timely fashion and to make sure that everybody has the opportunity to express themselves and to have all of their questions answered. So now that I told you all about the problems, are there any solutions? In the end, it's all about money and time, and there's not enough money in the healthcare system. So you can talk to your member of parliament or your government representative and urge them to make healthcare spending a priority. Also, you can take better care of yourself. You can check out our video on tips for beginner workouts. And finally, if there's no getting around a long wait, just make sure you plan around waiting in the clinic if you go to see a specialist. I hope I've given you insight into the real reason why your wait at the doctor's office is so long. If you liked the video, be sure to give us a big thumbs up and share it with a friend. If you're new to the channel, subscribe and hit the notification bell, because like, what else would you be doing?
Reasons one, their leading scorer, Carmelo Anthony, 27 plus.
As always, that's been a word from Dr. Chris, not your everyday ortho.